Well, the numbers are jarring, and we continue to see them as far as suicide, and America's young. Suicide deaths climbed 62% among 10 to 24-year-olds between 2007 and 2021. And one statistic that jumped out from recent research is that most of those had seen a healthcare provider within months of their deaths.
And that's really upsetting and jarring. A psychiatric professor at CU says that suicidal youth don't often end up at mental health providers. Instead, they're often sent to an emergency department or their primary care providers. So we're going to talk to Dr. Payal Kohli, our 9 News medical expert right now, to kind of lay out the problem for us. And when we talk about suicide, it's a huge problem in our state.
Yes, it is. In fact, in our youth, it is the #1 cause of preventable death in teens and adolescents, which is higher than the national average. So we as a state are doing worse than the rest of the country. And what we've seen in the last few years, unfortunately, is that the rate of death by suicide has just continued to increase. It's really becoming a huge crisis when it comes to our young people.
This idea that youngsters especially end up in emergency departments or seeing their primary care physician about stuff they're going through. Oftentimes I hear stories about people trying to get into psychiatric care, but there's no space, there's no room. There aren't enough people to treat.
It's so true. I mean, if you want a psychiatrist, sometimes the wait list can be 3 to 6 months long. And the point that you're making here is that these people are being seen by the medical system. In fact, 8 out of 10 of them were seen within months of their death by the medical system. But it's our fault. We're not recognizing them. We're not recognizing because we're not asking the right questions. We're afraid to have a conversation. We don't have the time. We don't have the resources. And I would say even so far as their parents, their community, their schools are not recognizing them, because these are not individuals that are just holed up inside their house. They're getting out there, and people are just not picking up on the signs.
People are around them. So what's the solution? I mean, what can we do besides the fact being more aware? What's the solution?
Well, I think first is to ask the why. And we've seen really a surge after the COVID pandemic in mental health problems, in substance use. The Surgeon General has issued a warning on loneliness as well as social media, both of which combine in our teens and adolescents. And their brains are very naive. They're prone to plasticity. So they believe things they shouldn't believe. They react in immature ways. And so that really sort of sets them up to walk down this path. So I think when we ask the why, we can sort of start to get at it. So I would say the first thing starts really at home, to create a supportive environment, but also as parents to be comfortable having a conversation that's a little bit probing, a little bit intrusive, and then to know what to do if there are signs of possible harm.
What about the system, the system as we call it? It's there meant to protect and help us, and specifically in Colorado, where clearly you say the numbers are skewing in a terrible direction.
So I would say there's sort of 3 axes in the system. One is the community. That's where everybody sort of needs to pay attention, your church and your neighbors and that what have you. The second is the schools, and that's a big one. And we do not have pathways in place, which is why this study from University of Colorado is very interesting, because what they've actually done is they've given us the guidebook for how to talk about suicide in schools. They've implemented programs. They've taught us how to talk about it. And I think back to medical school, we spent 4 years learning about medicine, and our psychiatry rotation was 1 month. And that's all we get exposure to as medical providers. Obviously, if you go into psych, it's different. But we really need to talk about it again because it's so prevalent. So I think really having that guidebook, knowing how to implement those programs. And then when it comes to the medical system, if somebody shows up in the ER, they go down a different pathway to get identified and get plugged into resources than somebody sitting in the office. But as part of every visit, it needs to be a question.
Yeah, it has to be discussed, put it out there, right? It just makes it every single time.
It does.
Someone might catch it then along the way.
Well, and what's interesting is this study found they've already found 500 teens who are at risk for suicide. Now, you never know which way that would have gone, obviously. Right. But here, prevention is the key, because there's no looking back. There's no, oops, we messed up, let's try again. We have to nip it in the bud.
Yeah, and it's one of those, the numbers are sad if they were 1, but the numbers are well above 1. There are too many. It's happening too often, and clearly we aren't getting it right yet anyway. Dr. Kohli, it's good to see you. Thanks very much.